أشرقت نفسي بنور من فؤادي.
Our sister, Dr. Almas Salim, who is a local GP in Manchester, and Dr. Zahid Ahmed, who is also a GP, and they both have special interest in diabetes. They will be talking about the current issues with diabetes. So over to you both. Please unmute yourself and hand over to you. Thank you.
Thank you very much, Tariq Bhai. I'll let Zahid Bhai start.
Good morning. Thank you for your kind introduction, Tariq. I was very impressed with Nasir and Yvonne presentations as well, because that's the theme all the way around, that lifestyle and peer support. And there are a few other things which we want to talk about together. There are a lot of statistics, and we every evening at 5 o'clock we hear about something from podium. But there is a one unfortunate factor, that this COVID, the total number of cases in UK or in England is 1.1 million. And the strange thing about the numbers is, in August, 1st of August, the total number of COVID cases in Greater Manchester was just 19,000. And it increased by 100,000 in the last 3 months. And there have been a lot of complications, and people have been lost their loved ones. So this has been a very, very difficult time. But we have found out in different research papers and ourselves as well, that there are certain things which are more likely to cause problems, and everybody in the community, especially with diabetes, they have certain questions. And the top of the list questions which I have listed here are: the people with diabetes more likely to get COVID? So I would like Almas to answer that question for us.
Thank you, Zahid Bhai. My name is Dr. Almas Agha. I'm a GP at Manchester Medical in Moss Side. Very, very impressive talk from Mr. Nasir and Yvonne so far. And like Zahid Bhai has just mentioned, that COVID has been increasing, especially in Greater Manchester. To answer these questions, I would suggest, like to say, people with diabetes are no more likely to catch coronavirus than anyone else. However, everyone with diabetes is vulnerable to developing a serious illness if they catch COVID. Sadly, diabetes is not in a clinically extremely vulnerable group. These patients have not been added to the shielding group in the first lockdown. Although there are some patients who were in the shielding group, they had diabetes, but with other factors and other comorbid conditions. Shielding currently is paused, and the government guidelines are not very clear about who to shield, and the patients who are shielding in the first wave are not supposed to shield, but they have to be very, very precautious. I would like to discuss some findings from the recent research which was done locally in the partnership between University of Manchester and Salford Royal Hospital, which shows the rates of diagnosis of type 2 diabetes, how it was affected, how the management of the diabetes was subsequently affected because of that. So I would ask Dr. Zahid if you could share some of the slides, please.
Can you see this slide? The research done in partnership between University of Manchester.
Yes, I can see it now. So the research which was done in partnership between the University of Manchester and Salford Royal was published at the University of Manchester. It showed the rate of diagnosis of type 2 diabetes was reduced by 70% in England. This was over the period of this. They have they've looked at it over the period of 10 years, that previously how the diabetes was diagnosed around this period. So the rate of diagnosis was reduced by 70% in England. They also found that the number of people with type 2 diabetes who were getting HbA1c test, which gives information about blood sugar levels over longer term, fell by 77% in England. Next slide, please. There were 45,000 missed or delayed diagnoses during this period across the UK. The reduced rates of diagnosis and HbA1c monitoring were particularly evident in older people, in males, and those from deprived areas. We'll discuss the factors in a bit. So 77 to 84% reduction in HbA1c testing compared to previous last 10 years. Reduction in metformin and insulin prescribing, supporting reduced rate of diagnosis and monitoring. And a short-term 110% increase in mortality rate in people with diabetes in England, and a 66% increase mortality rate across the UK, which was extremely very sad. This was mainly because when GPs were advised to reduce the footfall and avoid face-to-face appointments. So there was a huge decrease between March and May, when most of these cases they went undiagnosed, or there was delay in their up titration of their management. So the decrease in face-to-face appointments, which impacted NHS, it did not only impacted the diabetes monitoring, but also impacted the NHS health checks. There's increased obesity rates due to lack of inactivity, and eating habits hugely impact. There was which also impacted on the diabetes control and the services. And when we started the services, sadly, we had a huge backlog which the GPs had to deal with. And on top of that, we recently had a problem with the reagents, where the tests, we were not able to do the routine testings. So this has great impact on patient care. So the lack of HbA1c monitoring also not only impacted on the patient care, in the sense that we're not able to do it, but it also impacted in the treatment intensification. Mostly we tend to check patients' HbA1c 3 to 6 months or yearly. But if you imagine, if it's not been done over a 4-month period by GPs, which include a lot of patients that we could have done and monitored, so they were not monitored. And when they come back after 6 to 8 months, the diabetes control was hugely impacted. There was physical monitoring was ceased, like we were not able to do the blood pressure. We were encouraging patients to check their blood pressures at home readings and talking to them over the phone to discuss it, but physically seeing them in the surgery, checking their pulse rates, checking their feet, checking their blood pressure, urine ACRs, they were all ceased for a period of time, which has impacted the diabetes control. And the lack of these face-to-face contact was immense, really. If you, even as a doctor, we felt that we wanted to see patients, but we were not. We were working in a safe environment, and were avoiding these footfalls. So, and the higher COVID-related deaths, it's well documented during this period. During the period of April, the deaths from diabetes type 2 especially were up to 110%, which was really, really extremely sad. I'll hand it over to Dr. Zahid, who will take over from me here.
Thank you so much, Almas. Almas just mentioned about having diabetes causes an increased risk of having severe illness from COVID-19. But it's not all bad news. The good thing is, if the diabetes is controlled well, and the severity of the illness risk is reduced as well. But the other risk factors which I would discuss as well with increased severity of illness with COVID-19 is obesity. And more people are obese, the risk is actually increasing. And then the smoking risk increases, then chronic obstructive pulmonary disease, and any immunocompromised state from on medication from any transplant, cancer patient, and associated chronic kidney disease. And we see that as a common theme. There are multiple things which are present with diabetes. People are likely to be obese. People are quite a few times they are smoking, and they have hypertension, and they have got um, all these risk factors addition to not just diabetes. So in the present day with COVID, so what is the key message? Key message is there is no way 100% people can be protected so far from COVID, but the most impressive and most important 3 factors which protect people from getting COVID is wearing a face mask and social distancing and washing their hands frequently. So these are the 3 most important factors so far. And hopefully next month we are hearing some good news about COVID vaccine. So that will be in initial stages as well. And the most vulnerable groups will be vaccinated first. But for the meanwhile, what patients have to do, they have to pay attention for the potential COVID-19 symptoms. And if those symptoms they feel, they should get in touch with the GP or the 111 service. The symptoms, everybody actually knows because of with WhatsApp messages passed around, and most of the people know a lot about these symptoms, that fever, cough, chill, shortness of breath, fatigue, muscle or body aches, headache, sore throat, loss of smell, taste. But one thing which I find from the patients is when they call, oh, I've got cough, but I do not have fever. It's not necessarily that you need to have all those symptoms to have COVID, but when there are persistent symptoms, it's better to get tested. And with patients who are diabetic and how to stay healthy and to prevent complications, there are few key messages which I would like to discuss. Talk to your GP, get your vaccination for flu vaccine and pneumococcal vaccine as soon as possible to prevent you becoming ill with them. And it is important to have a lifestyle, which Nasir mentioned, Yvonne mentioned, that lifestyle, staying active and eating healthy, and that helps with the coping with the stress as well. But along with them, we all say that to stay home, stay at home, stay healthy, keep active. But in case of emergency, please do not delay seeking emergency. If you have any underlying medical condition, you should continue to follow the treatment plan. What we have found out, there were, as Tariq also mentioned, that sometime because of the lack of medication supply, people did not arrange medication in advance. So they should try to get in touch with the chemist or send an email by electronic methods, which we have adopted. So to get at least 30 days or even more than 30 days prescriptions if possible. And not to have a bigger stock, but still should have at least 1 month supply of medication at home. and do not delay getting emergency care. If any other symptoms come, and speak to 111, the GP or health provider. Because what we have noticed also, I cannot put an exact number, but I'm just guessing. If you see the total number of deaths from NSA, around 20% increased deaths are not from COVID. So that can be related to, and that we have found in certain cases, that people do not seek medical help when they need to. We have seen people having chest pains and not going to the hospital worried about getting COVID, but they die from heart attack. So, and when patients are sick, we suggest to monitor their glucose, check their temperature, and keep a hypomanaging kit handy. And they should take plenty of fluids. And if they're feeling sick and vomiting because of risk of diabetic ketoacidosis or any other severe complication, they should get in touch with the doctor. And there are plenty of other things to talk about, but I will stop here and hand over to Tariq Bhai.
Thank you very much, Almas and Zahid. Very informative. I hope our audience have picked up some key messages. What I picked up from this presentation is a couple of things. One is that COVID-19 is real. We have seen the real deaths because of COVID. So do take it serious. Do take precautions, social distancing, face covering if you're going in crowded places or very confined spaces, and wash your hands. Wash your hands at least for 20 seconds with soap and water, and use hand sanitizers wherever you need to. And also, this COVID period has had a big impact on the diagnosis, delaying in diagnosis potentially, not just for diabetes, but many other conditions. In relation to diabetes, what I would suggest is that people around you, you are already well aware, that's why you're here. But there will be people around you who may not be aware of this situation. So if somebody is at a high risk, or somebody has a strong family history, or any symptoms suggestive of diabetes, they can go on Diabetes UK website and check their risk. There's a calculator which can be used, and it'll give you the likelihood of having diabetes. And you can use that to get in touch with your GPs if you need to. Thank you very much, both of you, as usual.
أشرقت نفسي بنور من فؤادي